Hi everyone, hope you're doing well and welcome to another episode of Spill the Beans. My name's Duncan Goldie. My guest this week is Alex Young, who is the CEO and founder of a innovative, award-winning, immersive enterprise learning solution for healthcare and some other industries as well. But obviously on this podcast we put a particular focus on the healthcare side of things. That company is called Virti. So Virti, basically they're controlled through VR, AR, MR, and they provide educational content in kind of like immersive. And if you can imagine, you put on a headset and you're kind of transformed into a situation which otherwise might be quite abnormal or quite difficult to replicate. So to be able to sort of replicate these high pressure environments, such as like surgery or emergency response and those kind of things, is critical really for a lot of clinicians. So Verti are really at the cutting edge of that, and they're experiencing some really great traction. So it was really interesting to speak with Alex, and I really enjoyed it, found it really informative, and I hope you guys do too. Cool. Alex, thank you so much for taking the time to feature on the podcast. How are you? Whereabouts in the world are you right now?
Very well, thanks. Yeah, thank you so much for having me on. I'm currently in Bristol in the UK, which our team is basically based out of. Our sort of global HQ is in Bristol, quite a cool tech hub outside of London. So yeah, very much enjoying being grounded, not being on a plane for most of the time.
Yeah, definitely. I'm sure it's a big contrast to what normal life is like for you. So, yeah, I mean, how's the kind of working from home situation? Have you been back into the office yet? Are all of your team still working remotely?
Yeah, so we've just started kind of reconfiguring the office actually last week and this week for the team to go back in. So around about 60-70% of our team are actually developers. So we're a very product focused company. And a lot of their sort of collaboration it can be done remotely, but often is best done in person. So I think what we're going to do is we're going to do a sort of soft return to normal, have a couple of days in the office, rest of the time at home, and then see how things go from there.
Yeah, exactly. Well, it sounds similar to kind of how the rest of the world, I think, is easing back into things, or at least in the UK anyway. But yeah, it's good to be able to have that flexibility, I suppose. So yeah, obviously you founded a company called Verti, which we'll get onto in just a second. But I mean, tell me kind of what's the story of Alex? I mean, how did you start off your career and what led you up to found Verti?
Yeah, sure. So, I mean, I'm pretty weird. So I'm basically a combination of someone who loves sports, gaming, and healthcare and technology. So my original job was as a trauma and orthopedic surgeon in the NHS, where I worked there for just over sort of 12 years. During that time, I was very interested in kind of business and technology. So I had a couple of companies. One I started when I was a medical student. Another I founded and scaled up when I was a sort of a resident around my clinical practice, both in the sort of health education space, really. And then I left clinical practice around about 3 years ago to go full time on Verti, really because I wanted to basically put all of my effort into the business side and sort of scale things up with what we do there. And just to contextualize, my big interest has always been how do we get the best out of humans and in particular the workforce. And during my time in the NHS, we've seen this during COVID, but I would say any healthcare professional, particularly those in the NHS, which is a publicly funded organisation, are just incredibly dedicated, and often the sort of support provided to them doesn't allow them, let's say, to sort of flourish in their training environments and can be quite stressful. So I wanted to build this platform that was effectively a little bit like how elite athletes have lots of data circulating around. They have multiple people around them, from nutritionists to performance experts to coaches to trainers, all improving their performance. And what I wanted to do was create something that really helped the employee to get the best out of everything they do. So Verti basically is a corporate digital training platform, uses a number of technologies, including virtual and augmented reality, as well as artificial intelligence, and basically puts people into difficult to access, potentially hazardous but infrequent environments to scale up their exposure to different types of what we call experiential or on-the-job training from a safe, on-demand environment. And then a lot of the AI that we've developed behind the scenes allows us to then effectively standardize how people train and actually predict how their training will then show how they will perform in real life, to really sort of create a new standard for training employees and improving human performance.
Yeah, absolutely. I mean, it's obviously quite different from how you started off your career, but was there anything that, I suppose, you know, in the early stages, you know, going down the sort of VR route seems to be, you know, that's the stereotypical, this is the future, right? Was that an easy decision to make in terms of, you know, it's obviously a very applicable solution to the problem you're trying to solve, right? But I mean, was that, did you have to iterate at all? Was that the original idea to go down the virtual reality route?
Really interesting question. So when I sort of first had the idea and we first started looking at different types of technologies, the actual problem we were looking to solve was one that I was seeing personally in the National Health Service, and lots of other people in different sectors are seeing as well, which is when you're actually in work, often you sort of learn on the job, and those on the job experiences can A, be quite infrequent, and B, be quite difficult to actually take learning opportunities from. So as an example for that, when I was doing my surgical training, I would rotate around a number of different sort of, you know, senior surgeons in a kind of apprenticeship model and learn from them. But depending on what day of the week or time or hospital I went into, my learning experience might be very, very different from one of my peers, either in the UK, certainly in places that are sort of resource confined or limited by geographies. And so really we wanted to create a platform that was able to scale those experiential learning environments while also collecting some unique data. So actually the first thing we started building was I jokingly say a very boring analytics platform actually. So we sort of started at the end and worked backwards and said, okay, what are some of the metrics that we would like to make quantifiable that are going to help our employees perform better and also help our organizations understand how they can improve the productivity and the performance of their staff. So we looked at things like communication skills, for example, which often is quite subjectively assessed or in fact not assessed at all, and things like decision making under pressure, and a lot of these kind of subjective, hard to quantify aspects that are incredibly important across any walk of life, really, for anyone, especially in healthcare, where stuff like communication skills really, you know, impacts the patient experience, and actually poor communication is attributed to about 70% of complaints in hospitals. So we built this analytics platform first, and then we effectively plugged into different types of technologies, which were able to give us quite unique data back. So as you mentioned, virtual reality, augmented reality was really great at basically tricking people's brains to thinking they're actually in environments so that we get as sort of truer data as possible back. And is also able to collect a lot of data on 3D positioning and movement and where people's eyes are looking with the newer headsets and so forth. But we also operate off mobile devices and desktop using things like camera phones and pulling lots of different types of data, but such that we're always kind of in continuous contact with the employee, whether they're in a VR headset or whether they're pulling their phone out of their pocket to access some on-demand training or well-being materials. So that was kind of our journey in the technology space. So we're really focused on sort of the data primarily rather than, I guess, the deployment method.
Yeah, absolutely. And then just around that, I mean, into what kinds of things are you seeing from the data that you're reviewing? I mean, how quantifiable are the results that you're getting into the, I suppose, the success of the platform?
Yes, it's been really interesting. I mean, because basically I'm a geek, both in terms of healthcare and technology and also research, as most doctors are. We really wanted to make sure that the platform was validated and was actually doing what it was saying it was going to do before we even got anywhere near commercializing it actually. So we've a bit unusually perhaps for what is effectively an ed tech startup, we've published a randomized control trial comparing our system to sort of traditional methods of training. And we've also done a number of pre-publication studies around lots of different aspects of the system. So broadly speaking, what we have found is we're able to quite accurately quantify and analyze conversational data and decision making under pressure using some of the technology I mentioned. And what we've then seen that translate into, and again, this is kind of compared to traditional teaching methods like reading a book, watching a video, in-person training as well, is that people will sort of retain information for longer and have basically a better learning experience. And actually, one of the really interesting things we found with our system was it, in a significant cohort, it reduced their anxiety and stress, particularly around areas or content that dealt with hazardous environments or infrequent environments. So, for example, in a healthcare setting, that might be people going down to manage a multiply injured road traffic collision patient in an emergency department, which is stressful for all the members of staff involved, but will happen relatively infrequently unless you're at somewhere like a major trauma centre. So bringing those infrequent environments actually shows to reduce stress and anxiety, which we already know improves performance regardless of anything else, which is really, really interesting.
Yeah, absolutely. And I suppose as time goes on and that data kind of builds, the evidence really does speak for itself. You obviously mentioned one specific example there, but I mean, it seems like such a massive product, and the potential for the product is just enormous in terms of the amount of content out there. Where are you up to in terms of the actual, I suppose, the syllabus or the contents within the product, and how are you kind of planning on scaling that as time goes on?
Yes, it's been very interesting. I mean, I think my previous companies were very focused in healthcare and provided quite a lot of sort of off-the-shelf content within how they operated. One of the really interesting things when we started developing Verti was we spoke to a lot of kind of educators or organizations as well as the end users. And we said, what are the specific things you value in this type of product? And I think overwhelmingly, one of them was the ability to customize our own content and make that scalable and specific to our organization. Because, I'm sure, as you know, each individual hospital, even in the United Kingdom, even though they're all part of the NHS, often have slightly different guidelines or slightly different ways to do things. And so, although off-the-shelf solutions are helpful to a degree, they're not completely recreating exactly what that institution might do. So what we actually did was, as well as providing some of our own content, the system allows educators, users, organizations to create their own bespoke content using some of our creation tools that are very unique to their problems and needs. So I guess, content-wise, we're then able to solve multiple problems for an organization. So for example, in a hospital, we've done deployments into mental health departments where there's a big focus on communication skills with patients. We've scaled into surgery departments where it might be more focused on the technical aspects or non-technical teamwork skills. And we've also done stuff outside of healthcare as well in places like oil and gas industries and corporates, where we do a lot of kind of soft skills training, leadership, bullying and harassment in the workplace. That sort of almost HR compliance type content, which is really interesting. So very, very, very sort of scalable, very broad, and we're quite problem focused. So when we sort of go into an organization, we almost provide a bit of a L&D sort of strategic role, and we say, what are your big problems and what should we start with first that's going to make the most impact to your organization?
Absolutely, absolutely. And has the pandemic in any way kind of changed the focus on how this is either being implemented or delivered? Or, I mean, has it been an obstacle for you, or has it been more of a kind of, I think quite a lot of businesses are seeing it as an opportunity as well?
Yeah, it's been absolutely fascinating, I think, from both a sort of, societal point of view, but also a business point of view specifically. So for us, we were talking about scaling in-person training back as early as 2018 when we sort of launched. And I think with specifically, in our niche, which is sort of training and employee performance, that's really sort of come to light where people are now remote and they're not able to access in-person training environments or role play, which is often the sort of standard for how your people are basically trained up. So I think that's probably shone a light even more on the problem. I think from a business point of view, we've certainly significantly scaled up this year. I suspect COVID has accentuated that as well. It's been interesting, I think, for us doing deployments actually, because typically if we deployed to an organization, some of our customer success team would go there in person, meet with people, show them the ropes and how to use the system and so forth. But we actually did a deployment last week, which was not only during sort of COVID restrictions in an organization in Texas, but there was also a hurricane there. So that was particularly interesting, getting that deployed remotely at sort of quite an extreme time. And we sort of have had to adapt around that. And I think from us as a business, we've probably benefited from those optimizations and going remote. Which has been sort of very exciting. I think specifically for COVID in our healthcare sector customers, what we've done is we put together a lot of basically free training materials, teaching people how to put on protective equipment, how to basically manage patients with the COVID restrictions, really to sort of help frontline health workers and carers and reduce their stress and anxiety around either infecting themselves or other patients. And probably one of the coolest things that's happened to me recently, I guess, as a founder of a relatively youngish company, was because of that, we got featured on the NASDAQ tower in Times Square, which was pretty cool, and picked up sort of a couple of awards from the NHS for helping some of the frontline healthcare staff, which was really humbling to sort of be a part of that response.
Yeah, absolutely, and it really does validate in itself the work that you're doing, not that it's really required at the moment, because it's obviously speaking for itself through the success of the platform and the products. But yeah, to be able to, I don't know which one's cooler, to be honest, to be awarded by the NHS or to feature on a massive screen in Times Square. So yeah, I mean, it's both very, very commendable recognitions, I suppose. So I mean, what's the future look like for Verti then? Obviously, you're scaling globally. Is it more of a case of just trying to get your products into as many different sites as possible and be able to assist with as many different kind of healthcare and other industries as possible, or is there anything more on the horizon that you can tell us about right now?
Yeah, absolutely. I mean, I think at the moment, certainly for us, it's really meeting demand, and as we scale, ensuring that we continue to give the best experience for all the sort of new customers and people we're working with as they come onto the platform. We're very much in scale-up mode. We are predominantly focused on the US markets. We've got our team based out in the US between sort of California, Texas, and New York. So we're definitely in scale-up mode. I think we've got a couple of new product launches on the horizon, meeting some of the needs that have cropped up out of COVID. So a lot of the demand has been for how do you effectively integrate some of our training solutions into webinars or live streaming, which has obviously sort of really spiked during COVID. So we've got a couple of products we're launching in that vein, and we're also exploring the patient education space, which I think is going to be really rewarding. So we're just finishing off some research into the effects of the platform for patient education, particularly around things like compliance, reducing stress and anxiety when people come in for operations, and things like that, really. So I think it's going to be very, very exciting going into 2021.
Yeah, absolutely. I mean, it really is the kind of future of interaction and those kind of things. So it's amazing. But look, we're almost out of time. So it's obviously a huge product and platform, and applicable to so many different professionals and hopefully patients in time as well. If anyone does want to find out a little bit more about the Verti platform, what's the best way for them to do that?
Yeah, definitely. So our website is Virti, virti.com. You can find us on Twitter at VertiMed, and LinkedIn and Instagram are sort of the same handles. And then we've also got a podcast. So I host the Human Performance podcast, available on all good streaming services, much like this one. And that really focuses on amazing kind of feats of human performance from the world of kind of sports, to the military, to healthcare, to business, and how organizations and employees can adapt some of those tips into their own organizations. So we're very accessible if anyone wants to get in touch.
Sounds it, yeah, definitely. Well, look, we'll put all of the links to that, all those, I suppose, social media platforms and your podcast as well, in the summary of this podcast, so people can just access it very easily. But for now, Alex, look, thank you so much for taking the time to feature on the podcast. It's been really, really informative and really interesting as well to see the kind of combination of innovation and the future of technology as well. So it's definitely something that we're going to be keeping a close eye on. But thank you for setting aside the time and giving us the time to tell us all about it.
No, appreciate it. It's been great chatting, Duncan. Thank you.
Definitely. Speak soon. Thanks, Alex. So that's it for this week then, guys. Thanks very much to Alex for taking the time to chat with me. Really enjoyed speaking with him. Great guy and a really interesting company. So great to hear another insight of how, a medical doctor has trained in this field and then sort of seen these things firsthand, and then had that entrepreneurial spirit to go out there and provide the solution themselves where there wasn't one previously. So I know that Verti are experiencing a lot of traction at the moment, so it's definitely one to watch. If you did want to stay in contact and keep a close eye on Alex and the team at Verti, then we've put some links in the summary of this podcast for you to do that as well. So I hope you enjoyed it. Reach out to me if you have any other questions. My contact details are there as well. Otherwise, we will be in touch, and I'll see you guys next time. Cheers.